My name is Nick Ashton, and this is my assessment of a patient with sickle cell crisis. Hi, my name is Nick. I'm going to be your nurse today. How are you feeling?
I'm in a lot of pain.
Okay. Where's your pain at?
It's in my hands and in my left hip.
Okay. How bad is your pain?
10 out of 10.
10 out of 10 pain. Okay. So before we start the assessment, I'm going to make sure that your pain is controlled and that you're comfortable, and we're taking care of that. So we're going to give you IV morphine to cover your pain. Have you ever had that before?
No.
Okay. So we're going to monitor for any side effects that might come from that, but we'll give you that. So administer the morphine. That way the pain is adequately controlled for the assessment. We're going to start by assessing your neurological status, okay?
Okay.
Will you answer a few questions for me?
Yes.
Okay. Do you know where you are right now?
In the hospital.
Okay. And what year is it?
2020.
Do you know the month and date?
July 31st.
Okay. Who's the current U.S. president?
Donald Trump.
Good. I'm going to go ahead and check your pupil sizes, okay? Look at me. All right. And I'm going to check reaction to light as well. They both react bilaterally to light. Do you have any headache right now?
No.
No headache. Any vision changes?
No.
Okay. Are you squeezing my hands for me? Okay, nice and strong. Just checking. Just make sure that you have strength bilaterally. Push up and down. Push up. Good. We're just assessing, making sure that there's no signs of stroke there. Do you complain of any weakness on one side?
No.
No. Okay. We're just checking neurological status because patients with sickle cell anemia and crisis can have some vaso-occlusion in the brain, leading to strokes as well. This particular patient has had strokes when we were younger in the frontal cortex, leading to some flat affect. Okay, so now we're going to check musculoskeletal. You said you had pain in your hand joints, right?
Yes.
Okay. Let me check this out. Any tenderness?
Yes.
Okay. Can you move your extremity, your fingers? Is it painful?
Yes.
Okay. Tender on the side as well?
Yes.
Okay. Any other joint tenderness?
Just in my hip.
Just in your hip. Okay. We're going to assess your gait. If you mind standing up. And I'll just have you walk back and forth here. Okay. Is that painful when you walk?
Yeah.
Okay. Take a seat. So we're assessing musculoskeletal status to determine whether or not you're having a vaso-occlusive crisis in maybe one of those joints, which it seems like you're on your hands and in your left hip, right? I also want to check the abdomen, see if you have any tenderness. So what I'll have you do is lay down for this part. And I'm just going to palpate on the abdomen, and you tell me if you're tender, okay?
Yeah.
Tender right there?
Yeah.
Tender on that side?
Yeah.
Tender down at the bottom
Yeah.
as well?
Yeah. No.
Just on top?
Just in the top.
Okay. All right. And then go ahead and take a deep breath. Just going to palpate your liver. I feel like I can feel it. Is it tender there as well? Yeah?
Yes.
Okay, and it's enlarged. Why don't you go ahead and sit up on the side of the couch for me. I'm just going to check your kidneys. Scoot forward. Do Murphy's sign. It's not tender there, is it?
No.
No. Okay. All right, go ahead and take a seat. I also want to check integumentary status. It appears that you have some jaundiced skin. Is that correct?
Yeah.
How long have you been having that?
About a week.
Yeah. Okay. This definitely indicates some liver problems, and you have an enlarged liver. We can feel in palpation as well. So, how is your urine output?
Not very much.
The little urine output. Okay. Just checking skin turgor. There is a little bit of tenting, which appears that you might be dehydrated and dry. And then check your mucous membranes. I'm just going to check your nose. You check your gums. Okay, good. It does appear a little dry. You may be having some dehydration as well. And with decreased output. But you're not having any flank pain in the back, right?
No.
No kidney pain. Okay. That could indicate that you're not having very much like a kidney infection, but you could be having decreased urinary output. One thing we can do as far as testing goes, we'll monitor your hematocrit and hemoglobin, and we can assess your respiratory status right now as well. So let's start by listening to your lungs. Go ahead and sit forward for me. Deep breath. Deep breath. Deep breath. Good. Let's listen to the front. Deep breath. Good. So your lungs sound clear, but we want to check for any diminished or absent lung sounds. You might be having a pulmonary embolism. Are you feeling short of breath?
No. Yes.
Are you feeling fatigued?
Yes.
Okay. This could be from the anemia. It does. Your lungs sound clear. It sounds like you're passing a lot of air through there. I don't see anything diminished or absent. Are you having any chest pain?
No.
And is the fatigue chronic, or do you feel like it's something that's just come on? Probably chronic.
Chronic.
Okay.
Very chronic.
Okay. Does it, when you inhale, is there any pain? Deep breaths? No?
No.
Okay. You just feel like shorter breath?
Mm-hmm.
Okay. So respiratory status is important with these kind of patients because of the anemia. It's also could lead to a lot of infections with sickle cell anemia, but your white count appears to be normal. I don't hear any fluid on your lungs. Let's check the cardiopulmonary assessment as well. Any heart issues?
No.
Have you ever had congestive heart failure?
No.
No? Okay. We'll check for any edema, and there's no generalized edema up top. A little bit of edema in the lower extremities, non-pitting edema down there. There could be some component of cardiopulmonary issues that's going on there with that dependent edema. Are you taking any medications for sickle cell anemia? Are you taking hydroxyurea?
Mm-hmm.
Okay. Do you take anything for pain at home?
Mm-hmm.
Yeah. Not morphine, though?
Mm.
Okay. How's your pain feeling now at this point?
Better.
It's feeling better. What would you rate it?
A 4.
4? Okay. That's really good. What we'll do is continue to monitor your labs. We'll keep you here. Make sure you're getting rested and adequate pain control as needed throughout the stay here. Like I said, monitor your labs, see if we need to give you a transfusion, but we're careful with that because we don't want to overload you with iron, but we'll transfuse as needed. Do you have any questions or concerns? Okay. Well, thank you.